This is a topic that's really near and dear to my heart because I think that there are many times that we don't realize how dangerous over-the-counter medications are. And we just assume because you could walk and pick them up yourself and take them to the counter and pay for them, that there's no risk with these medications. And so when I was preparing the presentation, again, it reminded me of many of the medications that we want to stay away from for our family members and loved ones who have dementia, but also for ourselves, because there are links to many of these medications that we know, when used for a long period of time, can ultimately impact our cognition as well. So we're going to walk you through some of it, right? And we're going to talk about some of the different medications. And I'm going to ask some more questions this time. I'm going to ask you more questions about, what do you know about these medications? And what do you think? And has anybody ever mentioned this to you before? Okay? All right. So feel free to stop me if you have any questions. And this is the first time I've done this presentation, but so I've got some notes. Normally I can just talk to me about stages of dementia and I could talk for 2 hours and I won't remember, right? Without any problems at all. But this time I'm going to have to peek at my notes every once in a while. Great. So the first thing we're going to talk about is something called anticholinergic medications. Anybody have any idea what that big word means? Okay. So an anticholinergic medication is a classification of drugs that block acetylcholine. Acetylcholine is a neurotransmitter that we make in our brain. Okay. When we block acetylcholine, we interfere with various functions in the body, including muscle movement, memory, and automatic functions, things like breathing and heart rate. So if you take a medication that interferes with acetylcholine and that blocks some of the functions in your body, like your heart rate, you're going to lower your heart rate. Now, if you're on a medication like a beta blocker to help with your high blood pressure, which already lowers your blood pressure, and you take a medication like this, you can significantly cause yourself harm. Okay? So we need to be very careful as we age of anticholinergic medications. They can cause dry mouth, they can cause constipation, they can cause blurred vision, urinary retention because our bladder can't, and dizziness and confusion, particularly in the elderly. When you have somebody who is already cognitively impaired and you give them an anticholinergic medication, you can significantly worsen their confusion. What are some of the names of those? That's what we're going to get to next. The number one culprit of anticholinergic medications are antihistamines. Oh my God. It's time. PM. We're going to get to it. And I can't do this talking in a minute, so we got to like it go. All right. Antihistamines are definitely something that we need to be careful of. Now, the thing you need to understand is that for most medications, we have something called generations. There's a first generation, a second generation, sometimes even a third generation. And with each generation of the drug typically gets better and has less effects. So it's the first generation antihistamines we have to be careful of. All right, cool. So let's talk about first generation and second generation antihistamines. So first generation antihistamines cause significant sedation. They make you very sleepy. The cholinergic effect is very common. The cholinergic effect is very common, right? So a large gets effects in these generations. They only last for a short period of time, about 4 to 6 hours. An example of this is diphenhydramine. Anybody know what diphenhydramine is? The brand name is for it? Very common. Mineral is the number one interest of powder medication. I'm always amazed at how shocked people are with how because it's literally every sleep medication that is out there, list them. See, I don't know PM, right? Yeah. So, like, now, so, it's an opposite. Something is short counter, and I say, well, natural percentage has no interval area in the first thing. Well, yeah, I think doing one thing. And then it has dihydrogen. Okay. Now, second generation anti-agonists not agonists. So what's a second generation agonist? To mean something like loratadine or citrusine. These would be Zyrtec or Claritin, right? You would take Claritin, it's good for 24 hours. You reach for Benadryl, which your allergies. Oh, and that it's not right. Now we need that short acting, quick acting antihistamine when we go rash, have an allergy reaction to a food or a drug. We need that Benadryl. Area of medication have very good uses of medications. Sleep's not one of them. And especially using it long term, that's where we get into trouble. We will use these medications for night, first let's go to sleep. Control of the control, right? And then you take your loved one home, it's been sleeping well, it's asleep, you get Benadryl, and next thing you know, it's up for back and on without a house. Because that 4 hour medication is now more in his confusion mode is through the work. Because that's which helps. And we could take for I hope you get there. You have to take the them. Yeah, it's not that bad. You recognize you need Benadryl. But you're taking anything you can take. That's not a problem. Right? So that's all right. So mechanisms as a follower, right? And weakness can be constipation. Expecting $700 amounts. Something overnight, you're struggling, or something nature on your mind, and you know you're not going to you want to take time off. I'm not saying you can never take these medication. What you should never do is take an spine. There's always a reason why you might need these medications, and that's why it's going to be hard. You said, oh no, maybe you can do it. It says this is not meant for prolonged use. Right? Please, please. You don't have an anticholinergic act which can impair cognitive function worse than nutrition. Um, so, yeah, some of these things feel just not tolerated. It's increased disorientation. So, between 8 o'clock, they fall asleep, right? 4 hours later, left at midnight, I will pop open. I have been small and hallucinating. They think there's a spider in the bed. They got to get out, they got mad. Why stop around and saw sleep? Very confusing. I should have never had that fear before. It's not a safe medication for something. House trying to compare that. All right. Let's talk about cold medications. So many of our cold medications include antihistamine and do that same thing, right? And adversely. So many medications can cause confusion, your condition, only person, you might push you to sleep. It's kind of like a right? Yeah. Think about this. What helps take have that because it's that awesome, right? There's also decongestants, the decongestants can really raise your blood pressure. So if you have blood pressure, you don't need to avoid some of the decongestants. So that you just, just cool your they're not very big. They're first. They're really basic. That's an example. That cognition is something. As we get older, we have a full more try to have multiple different problems. We have blood pressure. We have skin issues that affect our ability to urinate. Your bodies and you have to urinating, taking and so you know, anti track might make you a ER is happening permanently for hours because that's also actually affected by that condition. All right. How safe is Advil, do you think? So, it's kind of, I don't know what you think. Uh, spoil your time. It's commonly extreme. People who want to take care of people on that should say children together. And they get Advil, yeah. So you can do occupation and yeah, eventually we'll put them together. So with the elderly folks, and again, elderly folks, kind of like so respect. I don't think it's significantly a picture of stroke. Right, right, right. Wow. Especially over the age of 65. Yeah. Because it affects clots, cardiac things. And so you can have hemorrhagic stroke, which is how there's two types of stroke. Regulated stroke. There are two types of stroke. There's called embolic stroke and hemorrhagic stroke. Embolic stroke is where a little piece of plaque or your arteries breaks off and travels towards your brain blocks that blood vessel and flows, and the tissue around that dies. One type of stroke. The other type of stroke, what's called a hemorrhagic stroke, and that's the one that's swallowed blood vessels first feed into the space in your brain and not causes the stroke. It's maybe a increase the risk of hemorrhagic stroke. Also, it's why pretty dangerous drug that's sitting on the shelf in the grocery store, drugstore, you want to buy. You're already taking Coumadin or Eliquis or Carfentanil. You know, you're going to pay. You just significantly increase your risk of having cardiac cardiovascular concerns, attack, worsening of pre-existing cardiovascular conditions, and using the blood pressure. And will actually increases your blood pressure. So again, have to look at other morbidity about it, other health concerns that yourself have, well, especially if they're not going to survive in a cardiac stroke, and you can do survive it, you're going to be significantly impaired. Dr. Hester us, most of us have maybe heard this. I was saying with aspirin, like you love the aspirin, you ulcer, right? So then we inherently code these codes, and they code them out so that they dissolve slowly in the stomach as they bubble in your stomach. And if you pick up with that, if you take them on a regular basis, they can influence a disruption in the gastric lining, and you can know what's called a GI. Develop the area of your stomach that has now been ulcerated away. And it's your blood vessel. Those GI two times the vitamin the aspirin's fine, but the 1 milligrams is chewable, so it dissolves slowly and it does not cause the same GI distress as that moment. And you can. One of those types of things, don't have high blood pressure, and not at risk for stroke, you're not taking anticoagulant for some medical disorder, and you sprain your ankle and you got some inflammation, you want to take Advil for a few days, it's fine. It's fine. But if you're already on anticoagulant, you want to check your health profile. You want to say, is it okay for me to take this, or is there a better medicine, perhaps a prescription, better for me need to take over the counter in those times and say, or that stuff, Tylenol, same area. Then if your healthcare provider has said them had a conversation about the medication, they should have talked with you about one antiviral to save the right of what the so nursing or behavior fibrillation. Um, Problem two that there's brand names and they're generic. So ibuprofen is a generic name for Advil or is Naprosyn. Something that's really what it can be. So, or these medications have potential correct. So we're going to add about the two most common brands. Kidney functions. As we age, our kidneys don't work as well. We want to creatinine, which is markers of how well our kidneys are functioning. They pretty well a little bit. Have empirical to have a medication regimen versus a called toxic that is toxic. So there's certain drugs that we know can worsen kidney function, and I would go as well. So children, they have to get like the so not to there. After distress, sometimes something out to be wrong, right? Two diets, not great. Yeah, so even though it isn't there, I'm used to take it as universally. It's the natural that's break it down and do it all the time. There's like again, we keep the label on it. When you tell me if you're buying a 200-pound bottle for 4 or 5 weeks, and there are many people who have radiance, who have not talking that like this. Realize the impact they're having on their kidney, on their stomach, on their cardiovascular risk. Okay, right. It's more complication of that. And it's going to try what's important. Right. Just make sure it's for sure the combination. All right. And then you'll next one, maybe. Step. So again, Advil, you get a prescription strength, right? It's prescription strength. Yeah, no, that's 800 milligrams, right? That's the prescription strength. These tablets that you're looking at here are 200 milligrams. So you can literally make prescription strength for it. And we are a society of what is good. Previous values, right? Which we talk about it's supplements. Some of them are dangerous are taking these supplements. So in terms of the Advil, you need to know you need 3, you need 4 that's prescription strength. It's not true with Tylenol. Tylenol, the maximum amount taken a day is 3,000 milligrams. So if you're taking 500 milligram tablets, I'm not even extra strengths. The extra strengths are 600 a day. We're taking 500s, that's 1,000 milligrams. If you take that every 8 hours, you've taken 1,000 milligrams. You are taxing your liver big time at 3,000 milligrams. Okay. So again, non-pharmacologic types of pain relief, heat, massage, ice, rest, So, kind of race, what it is, that's not a part of life. It's just something to do life when you have you're out on vacation. I would say, like, it's like, does anybody know what a PPI is? Oh, I know it's compound pump inhibitor. And what that does, it increases the gastric acid in your stomach. How many are you familiar with the connection between the gut and the dementia? It's a kind of bacteria. It's a bone. So found that long-term PPIs increase the risk of dementia because there's a correlation between the toxins in our intestines and the blood-brain barrier. The leaky gut, those toxins leak from our stomach and intestine out into our bloodstream, and we make it to our brain because they can cross the blood-brain barrier. So having a healthy GI tract, probiotics, foods that are whole grains that have conservatives and chemicals and will help maintain the GI system, and that will increase gut. Now, gastric reflux are good because if you eat the gastric reflux untreated for a long period of time, acid bubbles up to the esophagus, involves local variants of esophagitis. Your esophagitis is where that something starts to grow. We know that if we eat something when you eat it for a long period of time inside of our body, we have a risk of development. So esophageal cancers can happen if the esophagus is irritated differently from the acid. So that's when the PPI really comes to play, and many people in their own physicians provide counter prescription strength PPIs that are picked on them for years and years to prevent embarrassing esophagitis. Now, what's the other way that we can do that? Firstly, we just can't. There's a problem with the moment. It's just not making that gas down, so we need to take the medication. But there are quite a things that we do in terms of our diet, in terms of sitting up, actually eat for a period of time. They're not having that piece of pizza at 8 o'clock, laying down, right? Lots of things to help prevent that influx that we have. Using a little bit of kind of like this, it's pushing up on our esophagus, pushes that gastric fluid out. So there's different ways that we can do this. Not always the best way is to go with PPIs along. There's time. It does happen. It does. But sometimes it's necessary to go. It's true that a PPI is coming and I've not read that in research. And typically they're targeting mostly the stomach, and well, also the GI tract. Yeah, again, if you don't have a healthy gut, you're more likely to have loss again of irritation. So could lead to it. Usually, I don't know if that sounds. I think that sounds like it does. What about vegetarian or I tend to get it in some. So this religion thing that can actually be very helpful. Yeah, it can be very helpful because it can help to digest the food and get through the GI tract a little bit faster. But again, all of these things in moderation. We don't have a great expecting too. Now you're taxing the system. You're adding more effective finance metabolites. All right, see, I've got a couple more notes here. Yes, we wanted to talk about pink guy. Yeah. That's still general. Yeah. next thing, same kind is H. Correct. Okay. Yeah. So there history is history of this, and then that PIs and stuff. The other thing I wanted to talk about was polysaccharides. And that's the toxin, and that's the one that gets correlated to the out of our body into our bloodstream and how it's how good GI to your bloodstream. How do you protect it from it? So, and there is more and more investigations and research being done that what happens to find to disease goes to right to cause patient brain information that happen in the brain, causes us to potentially lose abilities for brain pain, whether it's because of concussion or because of toxins that are present in the brain tissue. The tissue is very, very fragile. So it's encased in, right? It's supposed to be left alone, right? All right. All right. So I'm gonna get on my soapbox here for a minute, but how many of you have heard his name? This thing looks like mix. Maple. It's there's a company out there now that uses selling these devices. It's called the LCCIPP. It has essential oils in it. It's rosemary, lavender. The name are Italian. And this one, the brochure else. You can get its FDA approved. Oh no. And even police for this right? Showing you how this is gonna work. And you know what? Because we have no regulations for sports, I can go out and get sawdust and putting in a capsule, mass marketed, and tell you that it's going to make you happy and successful, beautiful, that you can stop it. Because I come little closet bottom that says the patient has not been, someone has not been diagnosed by the FDA, it's not been to diagnose or treat anything. It's big, it's big. I've got a superstar. It's this thing of his nose, telling him that he's Scottish and better. And there's no way to move next. So let's talk about cells. Antioxidants. Antioxidants have mentality to the universe. And anti-inflammatory. That's how we get information from the body, right? We can find out. That's a lot of that's to prevent your Alzheimer's how progressive or dementia becomes, right? It's progressive disease. Blood tests that show that you're deficient in all of these things, right? The high dose antioxidants actually can be very dangerous for the brain, especially people who get dementia. So just first of all, think about it, I don't have a lot of benefit brain health, but when it's given in extra high doses, it actually can be quite detrimental. For example, right, eat like how we look. So you get average FDA allowing the vitamins they give out any and look at it's like go straight to the FDA like sometimes, so it's an equivalent milligrams with that 50,000 milligrams. And the response I get all, I go, why is it well? So I go out to my urine and be tough. The roots have passed while we're in the good. So, St. John's Wort actually was very similar to antidepressants. Stage 12. So basically, start with the that's sort of transparent. So it will supplement and actually impact neurotransmitter in your brain. You have to be very careful on what dose that is. One of the things that they started doing for those people, for those companies that need supplements that want to be able to sell their product with to their health, their habit, they started using what we call third party labs. So a third party lab is someone who is not affiliated with trade or pure encapsulations or any of the other companies that make these. And on their product, there's a seal from a lab that is a third party lab that tests what is in that bottle, actually what you're buying. So when you go and buy supplements, either in store, GNC, online, Amazon, you want to make sure that the third party seal is set. It's more expensive. It's because you know you're getting what you're supposed to be getting. So the first thing you're supposed to is that they offer way above normal should be. And then secondly, a lot of times there are other chemical products there. It's true. Shouldn't use the so you can have that organic. So organic has to do with pesticides, right? Organic has to do with spraying the pesticides. So obviously make sure it's better, right? Pesticides get into the sources. Now there are certain things when you think about it, like you really don't need food in organic. Because if you think I would pick organics. Why? They much lower than strawberries. Strawberries have very thin skin. So buying organic food is always better. Again, it's not that it's possible. It's organic. Right? Very expensive. It's pesticide doesn't mean that it's actually licensed. It's not. I don't think that my state has tested. I mean, pretty fun part. You make stash, you feel. You how much? Sure. Yeah, it's usually like a ribbon film and it's top of the pretty bad. It's neutral store of all of this. Yeah, it's your pretty bad. So I'll tell you, B12 is the means environment kind of like a technical B12 plus 200 and they are dragging it. Yeah, right. I saw the difference. What about all this other stuff? Walls of shots that you, yeah, they kind of scare me. So the how much are anything and how much can you tax your body? I think also points on that. And it's was good more and better. Not necessarily true. Right? I had one there's like right, which I like projection. And this is just like we couldn't measure control system. They left defined. Now, do I know that it was from the 12? I have myself a lot of research to see if there's any connection between excessive meals and vegetation. Because it does represent part of water. Exposure to it, and there is every other possible reason why. I wait. That's why look at anecdotal side, site. Right. Like study that situation, we wonder again, if you expose somebody to high doses for a long time, and just effective. So again, if you had 12 injection once we right? Yeah. Yeah. People in the time as memory, all that. One of the biggest risks of that large system learning can be so that moderation. Again, get it, your body has to set. They want to take it out. These moments kind of great. That anti-coagulant, that's all. Well, multivitamins of iron. So excessive iron is really bad for you. So like and the reality is after the stop demonstrating, you really shouldn't have iron deficiency. Yeah. Eating a healthy diet and not eating every month. We can keep up our people with an automatic. Now there are blood disorders which you have non-iron, anemia. It's yourself up on iron. It's not necessarily going to make you have more energy or okay. This is has that higher continues so not so those are foods. Yeah, it's better than iron continues so cooking has iron. Has iron. Iron has iron, which is a different food. It's okay. Memory. No, not much. You have to be separated. Yeah, you've got to help. You have to remember that supplements do not go rigorous studies. The drugs do. Everybody wants to complain about what the drugs are. I'm not saying those who are wrong with it, they do double-blinded controlled studies that go ahead and validate medications are actually safe. And because clinicians and scientists can see it, right? Anyone in the patient I know how it's supposed to happen too. 85-90% of the time it works. And I know that medication is doing that. Even some people who are writing metabolite registered medication or school metabolite registered medication not have the same effect. The majority of people should have the same effect. Can't say that it's true. Also, it's we don't have studies that like that. So that can be you had herbal supplements to that was include herbal tea. No, because herbal teas began that's contributions water right? It has to conserve those right? We've been talking about herbal supplements where you might be, 2 or 3 and 4, Another perfect example. More melatonin is not there. It's like a high dose of tolerance. It's the same ways, right? What I said. It's really best of just like full hygiene or much more important in terms of, making sure that you have a set routine at night that you do, that you do, two things a day. Well, what you do two things a day? It's one of them. Sure. You shouldn't be sitting in bed and brain that recognizes that you're awake and you're in bed. Ruin your sleep hygiene. You shouldn't be watching TV. And the very last thing you should be doing is on your iPad or your phone in front of that new screen right before you try to go to sleep. We would follow a lot of these things. So we want to reach that template and stuff, right? And see if I can get very important. I think they've got exercise to take. So just like, well, I don't think it's nothing like that. Stop and see you're out. Doing that. Instructor at Town Square, I'm exhausted. They sleep really well. They feel comfortable every day, but they don't come to Town Square a lot during the day. Sleep as well, right? Your body can sleep. So why don't you use up napping your own day? Same activity for those of us who are still coming to the talk about and well, exercise or floating, sleep better. But we're very serious using it today. Right. So yeah. So this stuff. Not with fluoride. No, never fluoride is in your cells. And people who have something you don't realize that they're actually people's fault. Now people have the training which is so close. Sometimes take talents in order to get there. Some of this do have small show up and it's like potassium, higher fluoride, fluoride, yeah. Yeah, potassium salt, right. So anything that has fluoride in salt, they get with it, salt again. Great. Any questions about how I feel? That one. Right. So you had a break. You have to ask me questions. And you have any other questions left? The real take home for this is to understand that the foundation for that sort of that for a long period of time. I think not. And so I better thoughts. You learn how to get money from longer and ever can I get they're trying to ensure it. Say, hey, my back side to chiropractor, all of these things happening. So I got like that. To just take how the medications a long period of time and be very dynamic. You need to learn other options so you have body experience instead of grabbing the color. So very often I do really use diet. There's a lot of things in our diet that can cause headaches. So one of the number one things are just sweeteners. So eat your sweet, look up diet sodas, things like that. But love reaching around the brain. Stress can cause headaches. Your headaches caused by stress, especially with all your stress in your neck and your neck. So massage, meditation, with the purposes. Dehydration are all a big issue for how is it? All different strengths now. It comes at 325 out of 650 now with the kind of hard things. So we just need to like biggest machine program. So I think so don't know if they share it. He's just not himself and quickly have a dinner. So he became himself. So I guess should and I'm pretty sure he's something that requires. I really like that. So and my friend, she's application, she said, I'm more than teenage ones that needs like especially out of the medication. With my not in your that pushing us. Yeah, so this how I know she it's how I can someone what kind of strong is just the butcher. Yeah, you know, it's student and pains it and making it up, right? They do up coming in next. I mean, I don't know, it's going to recommend the that's fine. Well, we're going to be and think that really cooking it. I'm going to be here. I'm just going to get all those after your processes. Turmeric, you can make teas with, or that. Personally, I think the key thing with right can be fresh, and you can do vegetables, and you really don't need to listen to yourself. Only two supplements I tell people are really important, right? These are really the only two supplements that have really been shown to help the complex of these. The complex is fine. It's going to be tough. Well, usually the B complex had the FDRs. Control, elegance, well, that's it. But again, these are things that you should consider with your diet. It's not about trying to load up what that's in your diet, your healthy diet. So I can't find how it's benefit. More than most anxious. Paradoxical reaction. So there are times when basically medication will be something sleepy and instead they copy off these reactions. And manager requests tend to be one of those medications where people will have paradoxical reactions. You can then go into it with those sleeping owls that are hyper. In particular, with children, more that way, let's heard that seeing of children. But see, then like on a regular basis, but allergy list. I think why I feel because you get these things to work and all of the it's because they got their reaction that you still like to give it out reaction to this. Many people will tolerate second generation so learn it's not very clear that you're looking to work feeling to grow. And pushing that to the box. See that absolutely. That's not good. See that you imagine that turn up box. He loves the time. And that's the kind of right. That's sometimes the issue is that stay on this long period. I know sometimes versus the trauma, right? Right? Or sure that she eats her evening meal at 4:35. Then you get a pretty right? Because you're feeding her with more, outside dinner boats with our Lawrence, that's 6 hours on that day. How just that's really stomach is more like I think it's so right. All right, guys, can you do something like that? That. So the thing I just can skip to the so